I will now begin the physical exam. We'll start with the skin. I'm noting that the skin is white, it is slightly pink, it is warm, it is smooth, and there is no hypopigmentation or hyperpigmentation. There's no obvious deformities, masses, or lesions. I will now begin assessing the nails. I'm noting that it is pink. Okay, the plates are firmly attached to the nail beds. I'm assessing also the capillary refill, and it is brisk, certainly less than 3 seconds, and that is normal. There is no obvious clubbing, ridging, pallor, cyanosis, and I'm noting that the nail plates and the proximal nail fold is approximately 160 degrees. Facial features appear symmetric at rest. Rob, I'm going to ask you to smile. Facial features appear symmetric with smiling. There's no asymmetry or drooping. The skull is round and regular, and it appears to be appropriate in relation to Rob's body size. And palpating now the skull, Rob, I want you to tell me if there's any tenderness. Is it tender? Does it hurt? Does it hurt?
No.
Okay. All right. There's no obvious deformity, masses, or nodules or lesions. And I'm noting that the hair is short, very short, and it is very dark brown. There is no white hair. There is obviously well-defined borders. There's no thinning of the hair. And I'm looking now at the eyebrows of Rob. It appears to be symmetric. The hair of the eyebrows is evenly distributed. There's no thinning at the lateral 1/3. And I will begin the assessment of the eyes. Now I will assess the eyes. The lids are firm. The upper lid margin rests at the superior border of the iris, and the lower lid margin rests at the inferior border of the iris, which tells me that the palpebral fissure is of normal size. Rob, can you blink for me? Lids close in unison with blinking, covering the entire eye. There are no erythema, edema, nodules, or edema. There is no drooping of the lid. There is no inversion. There is no inversion. The eyelashes are dark brown in color. It is evenly distributed and outward pointing. I'm not noting any infestations or edema at all. Looking at the bulbar conjunctiva, I'm noting that the bulbar conjunctiva is clear. It is shiny and smooth. There is no lesions or injections. The palpebral conjunctiva, pull down. I'm not noting any edema, lesions, or any nodules. Looking at the sclera, I'm noting that it is white. It is not icteric. Rob, I'm going to ask you to look straight ahead. I'm noting that the cornea is shiny, it is translucent, it is moist without any obvious arcus, ulcerations, or any abnormalities. I'm now looking at the other side on his left cornea. I'm also noting that there is no obvious arcus. There is no abnormalities. Now I will perform the corneal light reflex. I will shine the light on his cornea, and I'm noting that the light shines in the cornea symmetric bilaterally without any obvious asymmetry. Moving to the iris, The iris is hazel. It is round and regular with clear markings. I'm not noting any abnormalities. There is no edema. The pupils are equal, and I'm noting that it is constricted to approximately 3 millimeters. The pupils are regular. It is round. Now I'm going to test for direct and consensual response to light. Rob, I'm going to shine this light on your right eye, and I'm noticing that the pupil constrict when I shine the light. Now I will do the same with the opposite eye. I'm noting that the pupil constrict as well with the left eye when I shone the light. Okay, so this tells me that direct response to light is intact. Now I will test for consensual light. I will shine the light on the right eye, and I'm noticing that I noticed that the pupil on the left eye constrict. Now I will do the same to the left eye. While doing this, I'm observing the right pupil, and I notice that it constricts when the shine light on the left eye. Now that tells me that it is consensual response is intact. Now I will test the eyes accommodation. Rob, I'm going to ask you to look at this light in a distance. I will bring it to his near vision. I notice that his eyes converge and his pupils constrict, which tells me that this is a positive accommodation response. Now the next test, tell me. The next test is the extraocular movement. Rob, I'm going to ask you to follow this light.
Okay.
Okay. I want you to move your eyes, not your head. All right?
Okay.
What I'm doing here is I'm trying to make an H. Now, I noted that extraocular movement is intact. There is no strabismus or nystagmus. Now, the next test is called visual acuity. I'm going to ask Rob to read the smallest letters in the Snellen, in the handheld Snellen chart, which is placed 14 inches away from his face. While holding that, Rob, I'm going to ask you to cover your right eye, and I want you to read the smallest letters that you can read.
Okay.
14 inches away.
D-E-F-P-O-T-E-C.
Okay. Now I'm going to ask you to cover your left eye and read 14 inches away from your face.
Okay. D-E-F-P-O-T-E-C.
Okay. Now I'm going to ask you to read the handheld Snellen and read the smallest letters that you can read with your eyes uncovered.
D-E-F-P-O-T-E-C.
Now, this tells me that visual acuity is 20/20 OD, right eye, 20/20 OS, left eye, 20/20 OU, both eyes, uncorrected with a handheld Snellen chart. The next test is visual field by confrontation. Rob, I'm going to ask you to cover your right eye. I will also cover my right eye, and I want you to fix your gaze with my uncovered eyes. I will bring my hand in 6 locations: 12, 3 and 6 and a clock, 6, 9 and 12 and a clock. When you start to see my fingers coming in, I want you to say yes. Okay?
Yes. 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 Yes.
Okay? Now I'm going to ask you to cover your left eye. Okay? I'm going to ask you to do the same.
Okay.
I want you to say yes when you start seeing my fingers. Okay?
Yes. 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 Yes.
Okay. Visual field are full by confrontation. I will now begin the fundoscopic exam. Red reflex is intact. The lens and vitreous are clear with no obvious floaters or opacities. I can see the retina. It is orange. It is clear with no obvious abnormalities. I can see also the arteries. It is bright red and curving. The veins are darker red and larger. Artery to vein ratio is 2:3. The optic disc is located medially. I'm not noting any abnormalities. The physiologic cup is 1/3 the size of the optic disc. There's no cupping or edema. I'm not noting any abnormality. I'm going to do the same thing to Rob's left eye. Red reflex is intact. You can see the retina, it is orange. There's no abnormality. The arteries are also bright red. The veins are darker. The optic disc is located medially, and the physiologic cup is 1/3 the size. There's no cupping. I'm not noting any abnormalities. I will now begin the assessment of the ears. I will inspect the auricles anteriorly and posteriorly. I'm noting that the size of the ears is proportionate to Rob's size of his head. Rob, is there any tenderness when I'm touching this?
No.
Okay. All right. I'm noting that the upper aspect of the ear is higher than the outer canthus of Rob's eyes, which is a normal finding. Now, palpating the mastoid area. Rob, is this tender when I'm touching that?
No.
Okay. It's non-tender, and that is a normal finding. Now, moving on to the ear canal, I will begin my assessment of the right ear. I am noting that there's a evenly distributed hair. There is no foreign object. There is no edema or erythema. I'm grasping the auricle up, back, and out. I'm looking at the tympanic membrane. It is pearly gray and shiny. The bony landmarks are visible. The cone of light is at the 5 o'clock. Moving now to the left ear. Grasping the auricle up, back, and out. Evenly distributed hair. There is no foreign object. The tympanic membrane is pearly gray and shiny. I can see the cone of light at the 7 o'clock on the left ear. Tympanic membrane is also pearly gray and shiny. The bony landmarks are visible. Okay. Now I will test auditory acuity. Rob, what I'm going to do is stand 2 feet away from you. I'm going to ask you to cover your left ear while I whispered 2 words. Once I whisper them, I want you to repeat them. Baseball, soccer.
Baseball, soccer.
Okay. Now I'm going to ask you to do the same. I want you to cover your right ear while I stand opposite to that, 2 feet away. I'm going to whisper 2 words. Baseball, soccer.
Baseball, soccer.
Auditory acuity is intact with whispered voice at 2 feet. Now, if I have a concern with Rob's hearing, I will proceed to a test called a Weber's test. What I will do is get a 512 hertz tuning fork. I will tap it with the palm of my hand. I will place it at the center of his head. Rob, can you tell me if you can hear it more in your right, left ear, or both?
In both, actually.
Okay. That means that Weber's test is intact without lateralization. Now, if I have some more concern with Rob's hearing, I will proceed and perform a test called the Renee test. What I will do is tap the tuning fork, place it the mastoid area. Rob, I want you to tell me when you stop hearing the sound.
Okay. Oh, I still hear it. Oh, yeah.
I need you to tell me when you stop hearing this.
Slowly going. Gone.
Okay, clearly air conduction is greater than bone conduction. Renee test is intact. Of course, I will do the same thing with his left ear. I need you to tell me when you stop hearing it.
Done. Oh,
I need you to tell me when you stop hearing it.
okay. It's gone.
Clearly, air conduction is greater than bone conduction. Renee test is intact. Now I will proceed with the assessment of the nose and the sinuses. Looking at Rob's nose, I can see that it is symmetric. There is no deviation. Looking at the nares, Rob, I'm going to ask you to cover your right nair, okay? And I'm going to ask you to blow, okay? Now I'm going to ask you to cover your left nair, okay? And blow. Okay. From this, I know that the nares are patent. Rob, I'm going to ask you to tilt your head back a little.
Okay.
Just going to look at your nose. Okay. I can only see the lower and the middle turbinates. There's no edema or erythema. It's the same. There's no edema or erythema. I can only see the middle and the lower turbinates. Okay, good. Now I'm going to check the sinuses. Rob, I want you to tell me if this is tender, palpating the frontal sinuses. Is that tender, Rob, when I'm touching that?
No, it's normal.
Okay. How about this?
No.
This is the maxillary sinuses and it's non-tender. Good. Moving on now to the examination of the mouth. Rob, I'm going to ask you to open your mouth. Okay? Say ah. Okay. I can see the tonsils. There's no excessive redness. The interior and the posterior pharynx. There's no obvious deformity. Okay. I can see the uvula, it is midline. Okay. The tongue is lightly papillated. Rob, I'm going to ask you to touch the roof of your mouth with your tongue. Frenulum is intact. You can see there's a moderate amount of saliva there, which tells me that the salivary duct is patent. There's no coating. Okay, good. Okay, Rob, open your mouth again. I'm checking the dentition here. I'm noting fillings. There's no broken teeth. There's no gap. It appears that the teeth are firmly seated in the gingiva. Looking at the gingiva, it is pink. I'm not noting any hypertrophy or any ulcerations. Okay, thank you. Now, the next exam is of the lymph nodes. Preauricular. Rob, does this hurt when I'm touching it?
No.
Okay. Post-auricular. Does this hurt when I'm touching it?
No.
Okay. Tonsillar. Does this hurt when I'm touching it?
No.
Submandibular. Does this hurt when I'm touching it?
No.
Submental. Does this hurt when I'm touching it?
No.
Okay. Occipital. Does this hurt when I'm touching it?
No.
Posterior cervical. Does this hurt when I'm touching it?
No.
Okay. Anterior cervical. Does this hurt when I'm touching it?
No.
Okay. Good. And that is a normal finding. Okay. I will move now to the assessment of the neck. Looking at Rob's neck. The trachea, it is straight and midline without any obvious masses. Rob, I'm going to ask you to swallow. Okay. The cricoid cartilage rises symmetrically with swallowing. I'm examining the thyroid. I am noting that it is not clearly visible with visual inspection. What I will do is palpate the thyroid. Rob, I'm going to ask you to tip your head forward to your left. Okay, that. I'm going to ask you to swallow.
Okay.
Okay. Does that hurt?
No.
Okay. I'm not able to palpate the thyroid, which is a normal finding. Now I'm going to ask you to tip your head forward to your right. Okay. I'm going to ask you to swallow again.
Okay.
Does that hurt?
No.
Okay. And I'm unable to palpate the thyroid, and that is a normal finding. Now, what I will do next is palpate the carotid pulse. It is 2+ on the right. And it is 2+ on the left. And it is regular. What I will do now is auscultate the carotid. Rob, I'm going to ask you to hold your breath.
Okay.
There is no bruit. Breathe normally, Rob. I'm going to ask you to hold your breath again. There is no bruit.